Hello, I'm Dr. Joseph Tauber. Complaints of eye irritation are the most common reason patients come to see us, often related to either dry eye disease or eyelid inflammation problems. Though the symptoms of these two conditions are similar, the treatment plans are quite different. What makes it more complex is that many patients suffer from both conditions and need to combine the two treatment plans. This can be confusing. Learning a little about dry eye and eyelid disease will help you understand our treatment philosophy and should help you stick with the plan we outlined for your care. Your comfort and best vision are our highest priority. Thank you for trusting us with your eye care.
The surface of the eye is lubricated and nourished by a protective layer called the tear film that contains a balance of water, mucin, oil, proteins, growth factors, and antibodies. When this tear film is deficient or out of balance, you may experience the symptoms of dry eye syndrome, including red, irritated, painful, and itching eyes. In patients with milder dry eye, discomfort can stimulate reactive or reflex tears that flood the eye to combat the lack of lubrication in your tears. But these tears won't relieve the problem because they are too watery. When this occurs, patients complain that their eyes are excessively wet, when in actuality they are too dry. In more severe cases, a sandy or gritty sensation is common. There are 3 strategies for treating dry eye. The first strategy involves the use of tear supplementation. This approach involves trying to find the best artificial lubricant for your level of tear deficiency, whether they be preservative-free tears and gels or eye ointments. Nutritional supplements are also helpful to reduce inflammation in the tears. The second strategy is tear stimulation. The prescription medication Restasis has proven effective in helping your eye produce more tears. The third strategy is tear retention. To increase the retention time of the small amount of lubrication your eyes do produce, the tiny tear drains in your eye, called the punctum, are closed with plugs, or with a more permanent means of treatment. It is also important to know that 50 to 70% of patients who produce a low amount of tears also have abnormalities of the eyelid margin that need to be treated simultaneously to achieve maximum relief from these irritating eye symptoms. Blepharitis is a common condition involving inflammation of the eyelids. It is a chronic condition that can reoccur if successful treatment is discontinued. There are 2 types of blepharitis, anterior and posterior, and many patients experience both types. Anterior blepharitis is the easier type to treat and is identified by an accumulation of oily and flaky debris on the lid lashes. To treat this condition, you will need to clean the lashes using commercially available eyelid scrubs or with baby shampoo applied with a cloth towel, not a cotton tip. Posterior blepharitis is a condition that affects the meibomian glands located on the back or inner side of the lids. The meibomian glands produce the oily substance that helps protect the cornea and keep the tear film stable. If the meibomian glands become dysfunctional, they produce abnormally thick oil that can eventually obstruct the glands. Once they become obstructed, they can become inflamed, causing burning, stinging, and variable blurred vision, and may also lead to styes and chalazions. The first approach in treating posterior blepharitis is to use warm compresses to soften the oil, then manually express the secretions by compressing the glands against the eyeball. To do this, looking upwards, place the side of your index finger just under the lower lashes and squeeze the lid firmly between your 1 finger and the eyeball for about 4 seconds. You should be pushing the lid against the eyeball, pressing towards the back of your head. Reposition your finger along each lower lid, compressing at 4 areas. While looking downwards, repeat this squeezing at 4 areas on each upper lid near the lashes, also towards the back of your head. So it's 4 seconds each, 4 spots, on 4 lids. Then scrub or clean the lids as you would with anterior blepharitis. If this is not enough to control symptoms, your doctor may try to change the consistency of the oil by prescribing oral medications to reduce inflammation and liquefy the oil. For severe cases, your doctor may elect to numb the eyelids and use a probe to open the blocked glands and restore the natural flow of the oils to the surface of the eye. This brief in-office procedure can help many patients. Once the specific type and severity of your blepharitis is determined, we will recommend a treatment plan that is right for you.